Welcome to this video on ethical issues in disaster medicine, focusing on navigating crises with integrity and principle. I am Dr. Nasser Hassan, an EM consultant. In extreme circumstances, we must navigate a significant ethical shift, moving from care for the individual to prioritizing care for the population. Routine care is based on the egalitarian imperative, ensuring every patient receives the best possible care. Disaster care shifts to a utilitarian focus, the greatest good for the greatest number, prioritizing overall population survival. The ethics of triage is the clinical application of distributive justice. It requires painful decisions about immediate versus delayed care, guided by beneficence and justice. The most difficult ethical burden is the expectant category, where resources are withdrawn from those unlikely to survive. The scarcity equation highlights the difficulty of resource allocation. Clinicians must calculate social utility using an ethical function that considers the probability of survival and life years saved. Crisis ethics rests on 4 pillars: the duty to care, transparency of process, and equity, which demands avoiding bias in life-saving decisions. During emergencies, healthcare workers face a dilemma between professional duty and self-preservation. The reciprocity principle suggests society must provide the best possible protection, like PPE, if workers are expected to take high risks. Ethical allocation criteria include survivability, random selection when outcomes are equal, the life cycle principle, and prioritizing first responders who are needed to save others. Palliative care in crisis upholds the ethical duty of non-abandonment, even when life-saving care is withheld. Principles like the rule of double effect and balancing family presence with infection control become critical. Public trust in ethical systems relies heavily on transparency and perceived fairness in resource allocation. Predefined guidelines significantly increase public adherence and trust. As noted in ethical guidelines, in disaster medicine, we don't just treat the patient, we treat the disaster through the patient, making choices that honor humanity even when resources fail. Thank you for your dedication to disaster medicine ethics. Please feel free to reach out with any questions using the contact information provided. These are the image sources used throughout this video.